Hello pharma guys, welcome to our channel Easy Learn Pharma. So today I am going to discuss about a new important part of the liquid dosage form. So what is that part? That part is solubility enhancement technique of liquid dosage form. So what do you mean? That means what are the techniques you have to use for enhancement the solubility of poorly water soluble drug in liquid dosage form. So in liquid dosage form or when you have to prepare the liquid dosage form in that time, what are the techniques you have to use for enhancement the solubility of poorly water soluble drug? Clear? So in this part I will discuss what are the enhancement technique. Okay, so before going to the part, first of all you should know okay, what do you mean by solubility, okay, or what do you mean by drug solubility. Okay, the drug solubility, that means it is the completely, the drug solubility is completely depends upon the amount of drug dissolved in the solvent. Okay, that means how much amount of drug are dissolved in the solvent, that amount of drug or that part you can say solubility of the drug. Okay, that is the solubility of the drug. So as for example, suppose in this beaker you have to take 100 ml water and 20 gram of sucrose, okay, and stir thoroughly. Okay, and after stirring, after some time you will be marked all the sucrose particles are completely dissolved in this medium. So in that time you can say yes, that is the solubility of sucrose in the solvent. So that is the solubility. So what do you mean by drug solubility? And drug solubility means the amount of drug dissolved in the solvent. Clear? So now come to the point. So why you have to discuss such type of techniques? Because all of you know the 99% drug or maximum drugs are poorly water soluble. So to enhance the solubility of poorly water soluble drug, you have to use some different techniques. So by using such type of techniques, you have to enhance the solubility of poorly water soluble drug. So now come to the point. What are the techniques you have to use for the enhance the solubility of liquid dosage form? So now come to the point. So first one is particle size reduction, or you can say micronization. Okay, and the second thing is surfactant. Second thing is surfactants. Next part is salt formation. Next part is salt formation. Next part is change in pH. Okay. Next part is co-solvency. Co-solvency technique. Okay. Next part is solid dispersion. Solid dispersion. Okay, so these are the techniques you have to use for the enhancement of solubility of poorly water soluble of drug in liquid dosage form. So what are they? Now first one is particle size reduction, or you can say micronization. Second one is surfactant. Next one is the salt formation. Next one is the change in pH. Next one is the co-solvency technique. Next one is the solid dispersion. So first one is particle size reduction or micronization. So how the particle size reduction or micronization will be enhance the solubility of poorly water soluble drug in the preparation of liquid dosage form. So let's see. Okay, so according to the name, you can easily understand. Yes, in that time, definitely you have to reduction the particle size, or definitely you have to micronize the particle size. So after reduction the particle size or after micronization the particles, definitely it enhances the solubility of poorly water soluble drug. So let's see how the particle size will be enhance the solubility of poorly water soluble drug. So let's see. So I'm giving one example so that you can easily understand what I'm telling regarding the particle size or micronization. So these are the two beakers are there. One is A beaker, another one is the B beaker. And in the A beaker, you have to take 100 ml water. Okay, to take 100 ml water and 20 gram of 20 gram of sucrose particle. Okay, And in the B beaker, the same amount of water you have to take, that is 100 ml, 100 ml water, okay? And in that case, same amount of sucrose, 20 gram of sucrose particles. Okay, listen carefully what I am telling. There is same beaker. One is A beaker, another one is the B beaker. In A beaker, you have to take 100 ml of water with 20 gram of sucrose particle, not particles. Okay, and in this case, you have to take the same 100 ml of water, but you can take 20 gram of sucrose particles. So in that case, we have to take the 20 gram of sucrose particle. That means you have to take the large amount of particle, okay, and that particle having the 20 gram, okay, the particle strength is 20 gram, okay. In this case, you have to take a small amount, or after micronization or after reduction the particles, you can take the 20 gram of sucrose particles, okay. So these are the particle size reduction of sucrose particles, and this one is the large particle of sucrose. These particle having the 20 gram, and this particle strength having 20 gram, okay, the same amount, okay. Stir properly, and now tell me, in which beaker takes the less time to completely dissolve the particles? And definitely the B particles. So why? Now because in this case, all the particles, after reduction the particles, you have to mixed, or you have to mix inside the 100 ml of water. So when you have to reduction the particle size of sucrose, in that time the surface area will be developed, or the surface area will be increases definitely. So this one is the surface area of the sugar particle, and this one is the surface area of the sucrose particle or sugar particle. So after reduction the particle size, the first point is enhance the surface area. Enhance the surface area. So after enhance the surface area, what will be happen? Okay, after enhance the surface area, what will be happen? That's why the all the particles are completely dissolved within a fraction of time. ଏମିତି କଣ ହଉଛି after surface area in sorry after increase the surface area, what will be happen? That's why all the particles are completely dissolved inside the medium. Now in that time, after increase the surface area, each and every particles, okay, suppose this one is the particle, okay. So after compulsory, after increase the surface area, each and every particles come in contact with the solvent, okay. After increase the surface area, each and every particles come in contact with the solvent, and also each and every site, each and every side of the each and every particle, okay, each and every side of the each particles come in contact with the solvent. That's why it takes the less time to completely dissolve in the solvent, okay. But in case of a beaker, so when you have to stir properly, in that time the first upper layer, okay, because all of you know those portion come in contact with the solvent, only that portion dissolve inside the medium. So when you have to mixed inside the 100 ml of water, in that time only that area, okay, only that area come in contact with the solvent, and that area only dissolve first. Then after some time the second layer will be dissolved, then next after some time again the next layer will be dissolved. Then that's why it takes the maximum time to completely dissolve in case of B. In this case, it takes the less time to completely dissolve. So that is the particle size reduction, and that's why after reduction the particle size, it enhance the surface area, and after increase the surface area, it also enhance the dissolution property, or it enhance the dissolution rate inside the medium. Clear? So the particle size. So before going to the drug, or before preparation of the liquid dosage form, when you have to take the drug, in that time first you have to reduction the particle size of the drug. That's why it enhances the solubility of the drug. Clear? Next part is salt formation. Next part is salt formation. So what do you mean by salt formation? Salt formation means what? All of you know that the salt part is highly soluble in water. Okay, the salt part is highly soluble in water. That means when the drug, if the drugs are not solubilized or if the drugs are fully water soluble, in that time, definitely you have to convert the salt formation by adding some salt. That's why after adding the salt, it converts into the salt formation. That's why it is more soluble in water. So it is easily enhance the solubility property of the drug. So how? Suppose I'm giving the example. Suppose phenytoin. Okay, phenytoin is the weakly acidic drug. Okay, so that is the weakly acidic drug. So if the phenytoin is weakly acidic drug, so the first point is to convert the salt formation by adding the basic salt. By adding the basic salt, as for example, NaOH, that is sodium hydroxide, and that sodium hydroxide is highly soluble in water. So when you have to add the basic salt in the weakly acidic drug, or when you have to add the in sodium hydroxide in phenytoin, in that time it convert into the salt formation. That's why it highly soluble in water. Okay, so in a simple way you can say, okay, in a simple way you can say कि if the drug is acidic, if the drug is weakly acidic, then in that time you have to add some basic salt. Okay, then it converts into the salt formation. That's why it enhances the solubility of the drug. If the drug is basic, if the drug is weakly basic, then in that time you have to add some acidic salt. So when you have to add some acidic salt in the basic drug, definitely convert into the salt formation, and that salt formation is highly soluble in water. Clear? So next one is, okay, so next part is co-solvent, a co-solvency technique. Okay, so already that technique I had discussed regarding the excipients used in liquid waste form. So please go through the link. Okay, next part is change in pH. Change in pH. Okay, so when you have to change the pH inside the medium, so what will be happen? That's why the enhance the solubility of the poorly water soluble drug in the preparation of liquid waste form. Okay, so let's see what will be happen when you have to change the pH. Suppose all of you know कि all the drugs are weakly acidic, all the drugs are weakly acidic or weakly basic drug. Okay, so when you have to convert the drug into the ionization, okay, when you have to convert the ionization form, in that time it is highly soluble in water. So how to convert the ionization? By using, if the drugs are weakly acidic, in that time you have to use some basic excipients. Basic excipients. So if the drug is weakly acidic, then you have to add some basic excipient and definitely convert into the ionization form. Okay, you convert into the ionization form. If the drug convert into the ionization form, and that ionization is the highly soluble in water. Okay, so if the drug is weakly basic, then you have to add some acidic excipients, then it convert into the ionization. Clear? And that ionization is the highly soluble in water. So when you have, so how the change in pH, or how the pH, or when you have to change the pH inside the medium, so what will happen? Now if the drug is acidic and if you have to add some basic excipients, then it convert into the ionization, and that ionization is highly soluble in water, and that ionization compounds, or that ionization form, it helps to solubility of poorly water soluble drug. If the drug is weakly basic, Then you have to add some acidic excipients and convert into the ionization, and that ionization is the high solubility in water. So that is the change in pH of the solubility enhancement technique. Clear? Next one is surfactant. Okay, so when you have to add the surfactant, or how the surfactant enhance the solubility of poorly water soluble drug in the liquid dosage form. So how the surfactant will be works? So first of all, you should know what do we mean by surfactant. Already I had discussed in the previous video. Okay, so what do we mean by surfactant? Surfactant means it is a surface active agent. It is a surface active agent. Okay, that means it works on the surface. It works on the surface. Okay, suppose this one is the beaker, and in this beaker, this that is the 100 ml of water. It contains 100 ml of water. Okay, so when you have to add the surfactant, it works on the surface. This one is the surface of this medium. That surfactant, after adding that surfactant, works on the surface. Clear? So now come to the point. Okay, how the surfactant enhance the solubility of poorly water soluble drug. So first point, you tell me in which time the drug will be solubilized in the medium. Now in that time the drug dipped inside the medium. The first point is, suppose this one is the beaker, and this beaker contains the 100 ml of water, suppose. Okay, and those drugs are not solubilized, or those drugs are poorly water soluble. Their drugs float on the surface. Their drugs float on the surface or dispersed on the surface. Yes or no? Okay, why? Now because the such type of drugs are poorly water soluble, that's why it float on the surface. In which time such type of drugs are solubilized in this medium. Now when the drug dipped inside the medium, when the drug dipped inside the medium. So why the drug are not dipped inside the medium? Due to some interfacial tension. Due to some interfacial tension. Okay, so when you have to reduction the interfacial tension between the particles and solvent. Okay, so in that time the drug particles dip inside the medium. Okay, so how you have to reduce the interfacial tension? Now by adding the surfactant, because all of you know what they mean by surfactant. Now surfactant means it is a surface active agent. It works on the surface. So when you have to add the surfactant, it works on the surface, but in that phase the drugs are present on the surface. Okay, so when you have to add the surfactant, in that time it reduces the interfacial tension between the drugs and solvent, and and the drug dipped inside the medium. Okay, so after dipped inside the medium, the drug getting the wettability. So after getting the wettability, the drug goes to the solubility. So now come to the point. Okay, so after getting the wettability, the drug getting the solubility. So how? Now first of all, you should know what is the schematic diagram of surfactant. That means how the surfactant works inside the medium. That's why it enhances the solubility of the poorly water soluble drug. Clear? So before you know that, first of all, you should know what is the schematic diagram of surfactant. Okay, so this one is these are the schematic diagram of surfactant. Okay, so this one is hydrophilic hydrophilic head. Okay, or you can say it is the polar head, or you can say it is the water soluble or water loving. Okay, it is the water loving head or water soluble head. Okay, clear? And this one is the tail part is hydrophobic tail, hydrophobic tail, so that is non-polar tail. Okay, so that is the water heating, it is the water heating, or you can say that is the oil soluble. Okay, so the surfactant having the two properties. One is head part, another is the tail part. The head part having hydrophilic nature and the tail part having the hydrophobic nature. Okay, so head part is the water soluble part, tail part is the water heating part, that means oil soluble part. Clear? So when we have to add the surfactant inside the medium, suppose this one is the medium, these are the water molecules. Okay, so when you have to add the surfactant, in that time all of you know the surfactant works on the surface. Okay, so that means when you have to add the surfactant inside the medium, and that in that time the surfactant looks like that. Okay, that means this one is the water soluble part, this one is the oil soluble or water heating part. Okay, so how the surfactant works inside the medium. Clear? Okay, and this one is water insoluble, water insoluble drug. Okay, so why the drug present on the surface? Now because the drugs are poorly water soluble, that's why the drug out on the surface. Okay, that is the before adding the surfactant. Okay, okay, so after adding the surfactant with the drug, so what is the diagram? That is the drug, that is the water insoluble drug. Listen carefully, water insoluble drug. Okay, so after adding the surfactant, when you have to stir thoroughly, in that time it forms the micellar, or it forms the micelle. That means the environment, the completely environment of the drug particles are water soluble environment. That means all the surfactant are hold to the drug particles. Okay, so these are the aqueous medium. Okay, these are the aqueous medium, and after enclosed or after hold the drug particles, it looks like both head part. So that's why the all the surfactant or the micellar solubilization dominant to the water insoluble drugs. That's why after formation of micellar solubilization or after formation of the micelle, it enhances the solubility of the poorly water soluble, because this one is the head part is the water soluble, these are the water soluble head, and after holding the surface, sorry, after holding the drug, it behaves like as a head part. So that's why after adding the surfactant, it enhances the solubility property of the poorly water soluble drug, and this process is called known as micellar solubilization process. Clear? So on that phase, the surfactant works to enhance the solubility of the drugs. So now, next part is solid dispersion. Solid dispersion. Okay. So solid dispersion is the most important technique to enhance the solubility of the poorly water soluble drug in liquid based form. Okay, so how to take, or how the solid dispersion technique you have to use, and how the solid dispersion technique works to enhance the solubility of the poorly water soluble drug. So first of all, you should take some drug particles. Okay, and that drug particles having the hydrophobic nature, that means water insoluble drug with some inert carrier polymer. Okay, in okay, So in a motor pistol, first you have to take the drug particles that should be hydrophobic, that means water insoluble, and you can take some carrier polymer or inert carrier polymer and triturate properly. Okay, and triturate thoroughly. Okay, after trituration, okay, after and that inert carrier polymer having hydrophilic nature, that means it is the completely or highly water soluble polymer. Clear? And when you have to triturate thoroughly inside the motor and pistol, reduction in their particle size, and due to reduction in the particle size, it enhance the or it increase the surface area inside the motor and pistol, and also all the drug particles are uniformly dispersed inside the inert carrier polymers. That means the carrier polymer holds the drug particles. Okay, holds the drug particles. That means all the drug particles are dispersed inside the carrier polymer. Okay, after that, when the carrier polymer come in contact with the aqueous solvent, in that time those carrier polymer or those part or those portion come in contact with the aqueous medium, and that part is solubilized with the drug particles. Okay, because if and suppose these are the carrier of the polymers, okay, and these are the drugs part, okay, and after trituration all the drug parts are completely or uniformly dispersed inside the carrier polymer. That means suppose these are the carrier and this one is the drug particles. Okay, all the drug particles are uniformly dispersed inside the carrier polymer, and the carrier polymer hold the drug particles. And when those portion of carrier polymer come in contact with the aqueous solvent, that portion will be solubilized with the drug particles. Okay, so when the portion solubilized in the aqueous medium, in that time it also solubilize the drug particles in the aqueous medium. So that is the solid dispersion technique. Okay.